Hello, my friends. I'm Dr. Linda Parker, urologist and senior health specialist. And today I want to take you into a conversation that almost nobody in the health system is having honestly with people over 75. For decades, colonoscopy has been presented as a simple, routine screening test that everyone must do, almost like changing the oil in a car. But the truth is that after a certain age, your body, your risks, and your priorities change in a profound way. And when those changes are ignored, a test that may have been very useful at 55 or 65 can become a real source of harm at 78, 82, 88. Before we go any further, I want to make something very clear. I am not here to tell you to refuse every colonoscopy or to ignore symptoms. Colonoscopy has saved many lives when used at the right time, in the right person, for the right reasons. What I want is something much more powerful for you: informed choice. I want you to understand risks that are rarely explained in detail, so you can decide, together with your doctor, whether a colonoscopy at your age is truly in your best interest or whether there might be safer alternatives. After more than 2 decades working with older adults, I've seen a pattern repeat itself again and again. A man or woman over 75, often feeling relatively well, is told, "You're due for your colonoscopy." No one really stops to ask, will this procedure actually extend your life or protect your independence? The test is scheduled, the preparation starts, and only afterward, sometimes weeks or months later, do the complications begin to unfold. Confusion, falls, hospital stays, new medications, and in some cases, a permanent decline in quality of life. That is what moves me to speak with you today. So in this conversation, I want to reveal 3 colonoscopy risks after age 75 that doctors rarely explain in detail. These are not imaginary dangers or rare technical curiosities. They are real, common, and especially important for bodies that have already walked many decades. The first risk is the underestimated impact of sedation and anesthesia on the older brain, heart, and lungs. The second is the strain of bowel preparation and recovery on a more fragile system, including kidneys, hydration, and balance. The third is the silent risk of cascades, one small finding leading to more procedures, more hospital time, and more loss of independence than anyone anticipated. Let's go through each one calmly and clearly. Let's begin with the first hidden risk: how sedation and anesthesia affect an older body. When you hear colonoscopy, you probably think of the camera and the tube, but in reality, for people over 75, the biggest danger often comes from what goes into the vein, not what goes into the colon. Sedation medicines that younger adults tolerate fairly well can cause profound confusion, low blood pressure, and breathing problems in older adults. A brain that has already experienced small vascular changes, mild memory issues, or early cognitive decline is far more sensitive to these drugs. A short procedure can be followed by days or even weeks of fogginess, agitation, or what doctors call postoperative delirium. I want you to picture this with a real-life example, because numbers and technical terms do not always show the human side. An 80-year-old man, living independently, still driving, still managing his finances, is told he's due for a colonoscopy. No one sits down to ask about his memory changes, or how he reacted to anesthesia years ago, or whether he already struggles with balance. He has the procedure, the sedation goes well in the operating room, and technically everything is fine. But that night, he's disoriented, wakes up repeatedly, tries to get out of bed, falls, and hits his hip. Within 24 hours, he goes from being independent to being in a hospital bed, in pain, frightened, and unable to walk safely. The colon was fine, the scan was normal. But the chain reaction triggered by sedation and confusion has changed his life. Sedation in older adults can also unmask silent heart and lung weaknesses. The same medications that help you sleep through the procedure also slow your breathing, lower your blood pressure, and change how blood flows to the brain and vital organs. In a 78-year-old with stiff arteries, mild heart failure, or silent coronary disease, that drop in blood pressure can mean less oxygen to the brain and heart. Sometimes the only sign is a vague weakness afterward, or a sense that I just haven't been the same since that test. In other cases, it can trigger arrhythmias, chest discomfort, or a hospital admission for heart failure. None of this is explained when someone simply tells you, "Don't worry, it's routine." And we haven't even mentioned medications yet. Many people over 75 take drugs for blood pressure, diabetes, sleep, pain, or mood. Some of these interact with sedatives, intensifying their effects or changing how long they stay in the system. A dose that would be safe in a 50-year-old with no other medications might be too strong for an 82-year-old with multiple prescriptions and a slower metabolism. The result can be prolonged drowsiness, confusion, or instability for days after the procedure, increasing the risk of falls and accidents at home. These are not small details. They can be turning points in an older person's health trajectory. Now let's move to the second major risk that is rarely fully discussed: the bowel preparation and recovery process. Many people think of the prep as just an inconvenient night in the bathroom. But after 75, that preparation can become a serious stress test for the entire body. To clean the colon, you are asked to drink large volumes of liquid solutions that flush out stool rapidly. This process doesn't only remove waste, it also pulls fluid and electrolytes out of your system. Younger bodies often compensate fairly well. Older bodies, especially those with kidney problems, heart issues, or a naturally reduced thirst response, may not. Dehydration in older adults isn't just about feeling thirsty. It can lower blood pressure, reduce blood flow to the kidneys, and make the blood thicker and harder to pump. If you already have fragile kidney function, the intense fluid shifts of bowel prep can worsen it. Some people end up in the emergency room with dizziness, fainting, or abnormal lab results after what was supposed to be a routine preparation. Others feel so weak and lightheaded that they can barely stand without help. For someone who lives alone or relies on a cane or walker, that weakness can turn a simple trip to the bathroom into a dangerous situation. Electrolyte imbalances are another silent danger of bowel preparation in older adults. As the colon is cleared, you lose not only water, but also important minerals like sodium and potassium. These electrolytes help keep your heart rhythm stable, your muscles functioning, and your nerves communicating properly. When they fall too low or rise too high, the consequences can include irregular heartbeats, muscle cramps, confusion, and even seizures in extreme cases. In a younger body, there is more reserve, more margin for error. After 75, there is much less room for these imbalances before they cause real trouble. Think, too, about balance and muscle strength. Many older adults already move more slowly, have weaker leg muscles, or live with mild neuropathy in their feet. The night of bowel prep often means rushing repeatedly to the bathroom, sometimes in the dark, sometimes half asleep, sometimes dizzy from fluid loss. Each of those trips is an opportunity for a fall. A single fractured hip can be far more devastating than any colon polyp. Yet when colonoscopy is ordered, very few clinicians stop to ask, "Is your home safe for this? Do you have someone staying with you during the prep? How is your balance? Have you fallen recently?" Those questions are as important as the test itself. And then there is the fatigue afterward. Even when everything goes technically well, an older person may take several days to feel like themselves again. Appetite can drop, sleep can be disrupted, and energy may be noticeably lower. For someone who is already borderline in terms of strength, that temporary decline can push them into a cycle of inactivity and muscle loss. They move less, eat less, feel weaker, and it becomes harder to regain their previous level of independence. A test that was meant to protect their health ends up nudging them quietly toward frailty. Now let's talk about the third and perhaps most underestimated risk, the cascade of interventions that can follow a single colonoscopy in an older adult. Colonoscopy is not just a yes or no test. It is also a hunting tool. When the camera is inside, any small polyp or abnormality becomes a decision point. In younger adults, removing a polyp can be a powerful preventive measure with a favorable balance of risk and benefit. After 75, especially in someone with limited life expectancy or multiple health problems, the balance shifts. Many polyps found at that age grow so slowly that they will never cause harm in the remaining years of life. But once found, they often trigger more biopsies, more procedures, and more aggressive treatment than is truly necessary. This is where the cascade begins. A small polyp is removed, and the pathology report comes back with terms that sound frightening. More scans are ordered. Maybe a repeat colonoscopy is scheduled just to be safe, or surgery is recommended. Each of these steps carries its own risks. More anesthesia, more hospital exposure, more potential for infections, blood clots, or complications from immobilization. For an 80 or 85-year-old whose main goals are comfort, independence, and time with loved ones, that cascade can become a thief of quality of life. The original intention, to prevent disease, gets lost in a chain of interventions that may not actually extend life at all. I have seen older patients who went into this process walking on their own, managing their homes, and enjoying their routines, only to come out of months of testing weaker, more dependent, and emotionally exhausted. Some ended up with colostomy bags after surgeries that were technically successful, but did not truly respect their personal priorities. When you ask them later what mattered most, they often say, "I wish someone had explained what could happen. I might have chosen differently." That sentence breaks my heart, because informed choice is a basic right, not a luxury. We must also talk about the emotional weight of false alarms. Colonoscopy can sometimes reveal findings that are uncertain, labeled as possible, precancerous, or needs close follow-up. For a person over 75, carrying those labels can create constant anxiety. Every stomach ache, every change in bowel habit becomes a source of fear. The months between follow-up scans are filled with worry. In many cases, those suspicious spots never evolve into dangerous disease, yet the emotional burden remains. When doctors fail to present not only the medical facts, but also the psychological cost of this surveillance, older adults cannot truly weigh what they are choosing. So where does this leave us? Are colonoscopies automatically wrong after 75? No. There are situations where a colonoscopy is still very appropriate and potentially life-saving in an older person. If you have alarming symptoms, such as unexplained rectal bleeding, unexplained iron deficiency anemia, major changes in bowel habits, or unintentional weight loss, a colonoscopy may be the best way to understand what is going on. If you have a strong family history of colon cancer or personally had high-risk polyps in the past, your risk profile is different from someone who has had several normal colonoscopies already. In those cases, the potential benefits of the test might still outweigh the risks, if your overall health and functional status support it. The key is individualization. At 75, 80, or 85, you are not a statistic. You are a person with a specific body, specific history, and specific goals for the years ahead. A vigorous 76-year-old who hikes regularly, manages all their daily activities, and has very few medical conditions, is very different from a frail 88-year-old who already needs help with bathing, dressing, and walking. Yet in many clinics, both are placed under the same generic colonoscopy schedule without a careful conversation about their real needs. That is not good medicine. Good medicine looks at life expectancy, functional status, values, and personal fears, and then asks, will this test help this individual live better or longer in a meaningful way? Let me share with you 3 questions I encourage every person over 75 to ask before agreeing to a colonoscopy. First, what is my realistic life expectancy given my overall health, not just my age? If the answer is that you are likely to live another 10 or more years in good function, the balance of risk and benefit for detecting slow-growing cancers may still make sense. But if multiple illnesses, frailty, or advanced age suggest a shorter horizon, preventing a cancer that might take 15 years to become life-threatening may not be a rational priority. Second, if this test finds something, what treatments would you recommend? And what would those treatments mean for my independence and comfort? A test only makes sense if you would actually be willing and able to undergo the treatments that follow. Third, are there safer alternatives for someone my age and condition? Options like stool-based tests or less invasive imaging may provide enough reassurance with far fewer risks. When you ask these questions, you change the dynamic from passive patient to active partner. You invite your doctor into a more honest conversation. Some will respond with gratitude and clarity. Others may seem uncomfortable because they are used to following standardized protocols rather than tailoring decisions to older adults. If that happens, remember, you are not being difficult. You are being responsible. It is your body, your colon, your brain, your kidneys, your independence on the line. You have every right to understand the trade-offs fully. I also encourage families and caregivers to be part of these discussions. If you are a son, daughter, or spouse of someone over 75, you can gently ask, what are mom's goals for the next few years? Is she more afraid of cancer or of losing her independence? Does this test move her closer to the life she wants, or does it expose her to risks she might not fully appreciate? Sometimes the person undergoing the test feels pressured to do everything without realizing that everything can include harm. A calm family conversation can bring those deeper priorities into the open so that medical decisions line up with what truly matters. While we're on the topic of prevention, it's also vital to remember that colon health is influenced by everyday habits, not just by cameras and scopes. Regular physical activity that is appropriate for your level, a diet rich in fiber from vegetables, fruits, and whole grains, adequate hydration, and avoiding smoking all play meaningful roles in maintaining bowel health. These habits also support circulation, brain function, and muscle strength, which in turn reduce the risks associated with any medical procedure. You may not be able to change everything overnight, but small, consistent improvements in lifestyle often bring more benefit and far less risk than one more invasive test. As we come to the end of this conversation, I want to leave you with one powerful sentence that summarizes everything we have explored together. After 75, the real question is no longer, have you had your colonoscopy? But does this colonoscopy respect your body, your risks, and your priorities? When that question becomes the center of the discussion, many older adults discover that it is completely reasonable to slow down, to choose alternatives, or even to stop routine screening, while still staying attentive to genuine warning signs and symptoms. Never forget, it is never too late to take control of your health decisions. Whether you are 76 or 96, you are allowed to ask questions, to request explanations, and to say yes or no based on what feels right for you. Vitality in the later years is not only about avoiding disease, it is about protecting your mind, your independence, your dignity, and your peace of heart. Sometimes that means saying yes to a test. Sometimes it means saying no thank you and choosing a different path. Both can be wise when they come from understanding, not from fear. If this message resonated with you, I invite you to reflect on your own experiences with medical tests. Have you ever felt pushed into a procedure without fully understanding the risks? Have you or a loved one noticed changes in memory, strength, or independence after sedation? These reflections are powerful. Share them with your family, bring them to your next appointment, and if you feel this video could help someone you love, send it to them. And if you'd like to keep receiving honest, compassionate guidance about health and vitality in the later years, I warmly invite you to subscribe and stay with me in this space. I'm Dr. Linda Parker, and it's an honor to walk with you on this journey of informed, confident aging. Remember, your health decisions are yours. Ask, understand, and choose what truly protects not just your years of life, but the life in your years.